everyone, and thank you so much for taking some time out of your day to listen to us. My name is Jonna Hernandez, and I'm with Home Care Assistance. I would love to introduce you to my colleague and friend, Megan Necrobecki. She is with Healthcare Transformation. And today we're really excited to discuss with you the future of value-based care and how home care can actually fit into this space. So Megan, I'd love to actually have you introduce yourself to our audience and our listeners and kind of take it away from there.
Yeah, of course. Thanks, Jonna.
Of course.
So hi everyone, my name is Megan Necrobecki, and just really briefly a little background about myself. I'm very passionate about reducing healthcare costs and improving health outcomes, and that's exactly why I started Healthcare Transformation, is exactly that, is to help both companies but also individuals in achieving their best health at the lowest price. And so I'm very passionate about home care in particular, and this is exactly how Jonna and I got together today.
Yes, and I think, I would have to say it's been a true joy meeting with someone like Megan, someone who's in a like-minded space and a like-minded profession, where really our mission is we want to change the way the world is aging, and we really want to be that proactive approach to quality care and really put a sense of purpose back into care.
Yeah, exactly.
Yes. So to tie us in, I'd love for you, Megan, to kind of bring our audience into what is this notion of value-based care.
Yeah.
It's a very hot topic right now. It's something that's very current and discussed, but I'd love for you to be able to expand a little bit about that.
Yeah, of course. And so I'm sure many of you, especially if you're in the healthcare space, have heard these terms, value-based care. And really what that means is that we're moving from this sort of old way of doing healthcare, which was volume-based. It was called fee-for-service, where every time you do something, you get paid, right? And that's not necessarily completely patient-centric. And so we're moving towards what's called value-based care, which really is patient-centric care, and it's more about achieving high-quality outcomes for patients. And typically cost and quality go together so that you can actually have more high-quality care, better outcomes, and then in doing so, you actually lower total cost of care in healthcare. And so we're really moving into a different sort of space in healthcare, where we bring together providers and empower patients and their caregivers, and really being more holistic and patient-centric.
That makes sense. And I think it's fantastic that there's more conversations being had at the table where we are wanting to be more patient-centric and just seeing now, and it's exciting for me as a home care professional, that we're actually able to have some conversations about what home care can do to be a part of the conversation for value-based care. I mean, from my experience, we are the eyes, the ears, the support system at the home. We are the professionals that are seeing what's really going on with mom or dad. We're really seeing what's happening at the home. Are there things that are missing? What more can be done to be improved? And knowing that in the whole process of it being a value-based care approach, we do feel that we're able to offer something that is more, I would say cost effective to making sure that individuals are staying safe and happy and healthy at their home, which, let's be honest, from both of our experiences, the aging population has worked tremendously hard to make sure that they have quality of life in the home that they built, the home that they grew up in. And what better way for us to be part of the conversation now to make sure that that senior stays home?
Yes, I completely agree. And this is something I'm very passionate about too, is I know plenty of people in my life even who have said very clearly that they would prefer to stay in their home, right? And I love my own home. I feel the same way as as I will age. But I think it's very important that we meet patients where they are, right? Which is in the home. And so it's and it's not just from there's sort of a difference, but they're all connected between health and health care. And there's all these different components that feed into health. And I think that really starts in the home and how we're providing kind of better, more holistic care to those patients.
Right.
And so I completely agree that home care plays an incredibly vital role in value-based care because it's being patient-centric, meeting patients where they are, really providing high-quality, cost-effective health and healthcare.
That's a wonderful point. And I think what is exciting is that we can't do this alone. So even though as a home care provider and a home care professional, we are in the home making sure that everyone is safe and we're adhering to the appropriate care plan on the heels of a discharge. But really, we can't do it alone. We have to work with a lot of different professionals to make sure that we're offering the best quality of care and still being extremely patient-centered, focused in our approach. But that's why I'm also very excited to, have Megan showcase a little bit of resources that home care assistants would love to really incorporate with some of our care plans.
Yeah, no, thanks, Jonna, because that's one of the things too in building healthcare transformation that I was really passionate about is how can we better help support, whether it's healthcare professionals or individual patients and their caregivers, and better understanding how to navigate this crazy healthcare system.
It's a puzzle. People don't know.
I know. And so as a healthcare expert, I wanted to be able to convey my expertise in a very simple format to folks so that they could better navigate the system, so that they can have better health at hopefully a lower price.
Yes.
So I have a few different resources that are available for folks. I have my Healthcare Transformation Handbook, which I have here with us. But it's really, I wrote this from a very simplified viewpoint of sharing my expertise, but allowing people to better understand how to manage their care and navigate the system. I also have other resources on my website, which is caretransformation.net. And so there's things like the Online Academy, which has different videos and resources available for folks. I have a YouTube channel. You can follow me on social media, Healthcare Transformation, Facebook or Instagram. So I'm available to help support folks in better understanding.
And I think having multiple ways of being able to reach this information is very critical. Nowadays in a more social era, a lot of us are getting our information through our cell phones. So being able to offer multiple different channels to getting this information is going to be really fantastic for, like Megan said, business professionals and consumers alike.
Yeah, of course.
Well, I want to thank you so much for joining me, and thank you so much to the audience for taking some time out again to listen with us. We hope that you enjoyed a little bit of what we had to discuss, and we're very excited, really excited to kind of tease something that we're both extremely passionate about. So we're looking forward to maybe doing a couple more things like this. We've got some great projects rolled up under our sleeves for 2019.
Yeah, so stay tuned because we're ready, and hopefully you'll be able to gain more information and insight from myself, Megan, and Jonna in the near future.
Thank you so much, everyone. Have a wonderful day.